name's Tina Lowry. I am the Program Manager for Strategic Initiatives with the BC Centre for Palliative Care. And I'm here today to be a bit of a host and welcome our presenter facilitators from the Red Cross. I'm here with Stephanie, who is my colleague and co-worker. She's going to be running the Zoom for us today. So if there's technical issues, she's there to help out and support all of you in getting through the next hour with sometimes some technical shenanigans that happen. Next slide, please. So I'd like to start with the territorial acknowledgement and recognize that the BC Centre for Palliative Care as a provincial organization, which actually has no physical office, we all are joining from across British Columbia or further afield. I myself am joining from what is colonially known as the Wasanich Territories, or what is traditionally known as the Wasanich Territories, or colonially known as the Saanich Peninsula in Greater Victoria. And specifically, I'm on the unceded traditional territories of the Tsawat, Sakem, and Tsartlip nations. We encourage all of you to pop into the chat to let us know where you're joining from. If you know the traditional territories, to include that in your message as well. Next slide, please. So we're here today for an ECHO session. The BC Centre for Palliative Care runs the Provincial Palliative ECHO program with support financially from Pallium Canada. ECHO is a all-teach, all-learning module that we are very excited to be in our 5th year of. The idea being that you are here to learn from and with each other, that we have some great expertise from our friends at the Red Cross that are going to share their experience and knowledge with you, but that you also are carrying and sharing your own knowledge, and that is going to create the real richness to today's session. I know they've built in some time for questions and answers and some discussion, so we're excited to see and hear from all of you as well. We do record the session. If you are, and we encourage you as part of ECHO to share your screen. And if you are uncomfortable with that, please do feel free to not share your screen, but your image. And if you want, you can also even change the name if that's something for privacy that you need or want to do. Next slide, please. Again, just a reminder, this was in part funded through Pallium Canada, who gets actually the main funding from Health Canada. And next slide. Now I'm excited to introduce our presenters today from the Red Cross. We've been chatting with these fine ladies for a few months now, and I'm excited to see this presentation for myself, which is on the power of social connections and their Friendly Calls program. Asha is the director of the Red Cross Friendly Calls program. She has 25 years experience creating large-scale programs, including national peer support, mental health, and a suicide prevention line. Doris is a coordinator of Friendly Calls, and she and I share sort of a kindred spirit in that we both realized in one of our early meetings that we have what I like to call very eclectic career histories, and we sort of enjoyed that. She has a background having worked, excuse me, in urban forestry, and that she also has a background and experience in training in psychology. And last but not least, we have Michelle, who had originally reached out to us, having attended some of our other ECHO sessions and series. And Stephanie and I were thrilled when she reached out and said that the Red Cross was interested in sharing information with our audience about the Friendly Calls program. Michelle has a background in Indigenous studies and social work, and she's been working with the aging population for about 10 years. So I'm going to turn it over to these ladies, and everyone enjoy the session.
Hi, everyone. I'm Michelle. I just want to start off by saying, as we move through the presentation, feel free to pop any questions in the chat, and then the last portion, we'll have time for questions, discussion, and of course, your feedback. So our goals, our learning objective for today will be to understand the health impact of social isolation and loneliness, understand the benefits of the Friendly Calls program on people, communities, and the health systems, and understand how the Friendly Calls program can assist the palliative community. If you want to change it to the next slide, we have an interactive poll to kind of get us started. Stephanie, could you set up that poll for us? So we're going to play Spot the Myth. Just a quick way to get us started and kind of gauge our knowledge. So select the one that is false about social isolation. So socialization is equivalent to smoking 15 cigarettes a day. People who are isolated or introverted, or 6 out of 10 older adults reported feeling lonely. So if you want to go ahead and just select which one is the myth or not true about social isolation. At one time or another, everybody in this room has probably felt loneliness, but we necessarily don't understand the impacts it has on our bodies and our mental health. If you picked B, people who are isolated are introverted, you would be correct because people can feel loneliness whether you're introverted or extroverted. I'll pass the mic to Asha to get us through the impacts of social isolation and loneliness.
Thanks very much, Michelle, and thank you everyone for joining us today. It was so wonderful to see in the chat people joining from across Canada, even though I appreciate this was focused specifically for BC. As Michelle mentioned, I think the word loneliness is something that we're used to. We will hear people say, oh, I feel a bit lonely, or I'm feeling a bit isolated, but we're not necessarily understanding the intense reality of this as a global and definitely also as a Canadian public health concern. So during COVID, it really lifted up because we all were feeling escalated feelings of isolation. What has been shown to be true is that is only increasing. So even though we're having in post-recovery Canada, we think we're connecting more with people, we're re-engaging more in our lives, but we're actually seeing the National Institute of Aging raised an alarm and a concern that we have so many adults identifying as being isolated. And this is a new reality in post-recovery Canada and a very significant public health concern. And that's not isolated to older adults, because a poll and further statistics through Stats Canada show that 18 to 24 have the highest rates of isolation in Canada. And that's common, also a common stat globally as well. Because of this, the World Health Organization has identified this as a very significant concern, and they've also launched an international commission. So the work within Friendly Calls is really to look at addressing social isolation and loneliness, and we'll talk just a little bit about some of those impacts. So definitely, as an individual, it may be surprising to see the impact not just on mental health. I think that's something that we come to expect, to see that it increases rates of depression and anxiety. That makes sense to us, but to also have an understanding that it increases our rates of heart disease, stroke, 50% increase in dementia, and it's the equivalent of smoking 15 cigarettes a day and can actually shorten our lifespan by up to 15 years. That's significant. So whether you're an individual or a caregiver, paid or unpaid, we understand that there's even higher rates of isolation among caregivers. And that's really important, especially for this community within palliative support. I know for myself personally, I've had the privilege of being a caregiver to my father, who was palliative for many years and recently passed. That's why I feel really so very honored that we've been invited to connect with you. And there's an innate isolation that occurs within those caregiving roles, regardless of whether it's paid or unpaid. Within communities, we see a ripple effect, and definitely within the healthcare system, people who feel more isolated actually can be the top 5% of users and can account for up to 50% of the healthcare spending. So there's an impact on individuals, communities, and the healthcare system that is already struggling under the weight and need.
So we have another little interactive portion for us. So in the chat, we would like to hear from you how you cope with feeling lonely. So if you want to just write some of your coping strategies that you use on a personal level. I know that sometimes when I am feeling extra lonely, I like to reach out to my friends and family. Yeah, those are some great answers. So we exercise, we call friends, walk your dog, envision yourself as Mr. Olympia while working out. Way to go, William. Great job. So, as it is very important that we have some good coping strategies that are positive when we're feeling extra lonely. We have Asha will help us explore the Friendly Calls program and the meaningful impact of connections. Thank you for sharing.
And it's great to see people still adding in the chat. As much as we're hoping to shed some light on the impact of social isolation and loneliness and how we address that within the Friendly Calls program, definitely the things that we do individually is so important, and it's really inspiring to see people keep adding to that. So just to give you a quick overview of Friendly Calls, and then Doris and Michelle are going to fill in more of the blanks. Friendly Calls is a national community health program provided through the Canadian Red Cross. It is available coast to coast to coast. So it doesn't matter where you live in Canada, as long as you have access to a phone or voice over internet provider, you have access to support. And unlike many services where it's consistently you calling out, with Friendly Calls after the initial intake, the majority of the calls are us calling out to them as opposed to them needing to engage. And a lot of people express how helpful that is. So with Friendly Calls, it is accessible. All of our team engage with cultural safety training. We work really closely with Indigenous relations team to ensure that we're genuinely accessible. And though it was originally established for older adults, as you saw from the stats, younger people are experiencing heightened rates of social isolation and loneliness too. So that's why about a year and a half ago, we expanded the service to be 18 plus, and really to support and focus on the addressing of social isolation and loneliness on people, communities, and healthcare systems.
The benefits of Friendly Calls we can see through protection of connection. So we're addressing socialization by providing a meaningful conversation or conversations, emotional support, and coping strategies. We're also strengthening community resilience by connecting people with their communities that they live in for things like recreation, resources, and basic needs. The ripple effect of reducing socialization and social isolation and loneliness by using connection and community resilience, we're reducing the strain on our already strained medical system and healthcare workers. In the next slide, Doris will help us explore the continuum of care and where the Friendly Calls lands within that continuum.
Thank you, Michelle and Asha and everyone. Yeah, so within this mental health continuum of Canada, we can see that the Friendly Calls acts as an upstream early prevention service that is accessible nationwide, or as we like to call it, coast to coast to coast service. There was a gap within prevention while other elements were well provided in Canada. So we can see here crisis lines such as Talk Suicide and the Indigenous Wellness Line, as well as 911, and now with 988 as a mental health crisis service. And we can see in the response support through Canadian Red Cross, whenever there is a climate or emergency crisis, we're there to support. But it's within the prevention sphere that we do want to focus on, because we believe that the friendly calls plays an important role within this continuum of care. It represents a national promising practice as the first national Canadian Red Cross community health program and the most accessible social prescription program in Canada. Internationally, it is a promising practice, with several countries reviewing friendly calls, and the Polish Red Cross launching friendly calls in January of last year to support displaced people from Ukraine living in Poland. As we navigate to the next slide, we will see some impacts of friendly calls. And as Asha mentioned earlier, there are significant impacts on health, physical and mental, from being isolated, from feeling lonely. And here we can see that people with weaker community connections make up the top 5% of healthcare users, costing the system $44 billion annually in Canada. So I just want to repeat that. So people with weaker community connections make up the top 5% of healthcare users. Think about how important being connected with those around you is. And this is where friendly calls can play a transformative role, we believe, because through regular, meaningful social connections, 8 out of 10 participants report feeling less lonely, feeling safer, and better equipped to manage stress. And these connections help close the gap in community belonging, really in that neighborhood level, even though we are a remote program, and potentially resulting in fewer emergency visits and police wellness checks. And we have been able to extrapolate that friendly calls has a potential savings of close to 11 million each year. And this falls in line with a KPMG study from the Canadian Institute of Social Prescribing on the return on investment for social prescription programs. So all in all, remaining connected is very important, as we can see from this slide. And yes, I want to also share some information about our program. Looking at last year's data, the friendly calls has expanded to be able to support more people bilingually, continuing our support in a culturally safe manner from 9 to 5 local time. I want to point out that we have logged over 79,000 total calls, supporting over 27,000 people with over 2.9 million minutes of life-enhancing support. In BC and Yukon, the program averaged 530 calls monthly in December, totaling, I think, over 21,000 minutes of connection, which is equivalent to, according to our calculations, about 15 days of straight talking for December 2024 alone. That's a lot of talking, and we're glad they're meaningful and supportive for our participants. In the next slide, I will just briefly go over the friendly calls process. So we call this impact because it is a responsive and continuous journey designed to support participants at every step. And although participants can essentially, join in through us or through our national number, etc., it always begins with intake that is trauma-informed and done by skilled staff. Participants are then matched with trained volunteers who provide that ongoing support that can last from months to years. Collaborative, person-centered plans from skilled staff helped strengthen coping skills and healthy habits in participants. And access to referral pathways and community resources are provided and encouraged, contributing to the one-on-one connections provided by Friendly Calls volunteers. And for those who do decide, the Friendly Calls, I've had it, it's amazing, I want to, do other things. For those discharged from the program, the process often transitions them into other supportive services tailored to their needs. So we try to ensure that there is a continuous loop of care for participants at all times in the Friendly Calls. And if at any point our volunteers do notice that the participant has higher needs, maybe they share something that concerns the volunteers, skilled staff will provide that wraparound support, including connections to resources and coping strategies and more. Yeah, so now I will pass this to Asha to share some reflections about the friendly calls.
Great, thank you, Doris. So, with friendly calls and the expansion about 1.5 years ago, as shared, there was an identified need to ensure that this type of support was accessible. So to be really clear, our approach is that friendly calls moves like water. We recognize that there can be similar programs locally based in different communities. So we flow into communities where there isn't access to a similar program, and or in a community where there is one, we kind of flow around. So if an individual maybe isn't meeting the parameters of the program, or perhaps there's some timing constraints that just don't seem to fit for them, then we're an accessible support. The reality is that as human beings, we have longed for and needed connection right from the beginning of language, you know, when we sit around in fires. So what we are doing is not new in the sense of we're connecting people, and yet the approach of, as Doris was just expressing, those wraparound supports, so that if at any point one of our 1,200 volunteers across Canada match with someone identifies, you know, this person is struggling, they need a little bit more, the skilled team are able to provide non-clinical support, and that's really important, especially because we've learned 2 really critical things in this last 1.5 years of expanded service, which allowed for more of that wraparound. The first is we are reaching those in need. So social isolation and loneliness is not going anywhere. We are seeing this increased rates across Canada. And out of a survey that we did, impact survey of over 300 participants, as well as over 300 volunteers, we were able to identify that the people we serve have significantly higher rates of living alone, 6 times the national average. They also have 3 times the rates of self-identified poor to fair mental health. That's significant. And a big difference compared to 14% of the general public and out of a Stats Canada survey that was conducted at the height of the pandemic. We also, the people we're serving, have double the rates of social isolation and financial insecurity. So we, as much as we're providing support around that connection, greater resilience, etc., we are also able to provide individualized referral pathways. So recognizing that the people we support often have, you know, multiple issues that perhaps layer and compound one another, we do also try to work with them to identify barriers and guide them to community-based services that can be a support in addition to the social engagement that we're focused on. So a big learning for us is it is supporting people in need. And the second significant learning is it is making a difference. So we've highlighted a couple of the impacts that we've been able to see. What's really powerful is that we're seeing this positive impact, not just for participants, but also for volunteers, which is wonderful and amazing. So we're seeing it in 4 key areas. One is on quality of life. So people are feeling safer, they're feeling better. We're also seeing improved coping and resilience, again, with both participants and volunteers. People just feel better able to navigate the stressors and the changes. And especially when we're reflecting on how, you know, a program like Friendly Calls can help address some of the innate isolation within providing care in a palliative environment, we can see how, you know, improving that coping and resilience can be such a pronounced and important impact. We're also seeing improved connections. People are feeling more comfortable. Sometimes I live in rural Canada. So I completely appreciate that we have, opposite ends of the spectrum in Canada. Within urban centers, there almost can be an overwhelm, unable to discern where's the best appropriate resource to engage with. And in rural Canada, it can be more challenging. So we work with people around comfort level to really support them. And the other element we found were volunteers were feeling more empathetic, they were feeling more connected, and it was supporting stronger societal connections due to the program. Something that was really surprising that came out was we anticipated that the program would improve social care habits, that people would actually feel more comfortable to reach out, that they might start engaging with family or friends in different ways, or engaging with community resources that can be as simple as going to a library or going to a Legion or perhaps going to a support group. We were really pleasantly surprised to see that it also supported healthy habits around physical activity, around healthy eating. And you might say, well, Asha, how does that make sense? It's not like you're sharing recipes, but when people are connecting on a regular basis, they're talking about normal things. They're talking about gardening. They're talking about getting out and walking. And what we've heard is that this is inspiring both the volunteer and the participant to take better care, to engage better. And all of this is then rippling out where we're seeing 3 out of 10 participants actually have improved their sleep as well. And when we know the impacts of these healthy habits on general health, we see this, again, this ripple effect that as much as social isolation and loneliness has a damaging ripple effect on individuals, communities, and systems, what we're seeing with Friendly Calls is it has a ripple effect beyond what we originally imagined and projected for the program, just through the power of connection and feeling that someone cares.
Yes, and here we would like to add some stories. We've shared a lot of numbers, a lot of facts, factoids. So here we would like to paint a picture of what the Friendly Calls and what being connected could look like in our participants. So this first one comes from someone named KO. KO shares that each volunteer brings something different to the table. It's so helpful that my regular callers know who I essentially am and how I can be. I still remember my first volunteers. So I find the sentiment very common among our older participants, especially ones that live alone. So they may lack regular connections because they're living in a rural area, or they may be homebound for whatever reason, and therefore they do not have that regular connection, or they're not able to speak with people because they cannot open up. They don't have that regular conversation with them. With this participant, KO, she has been with us for 4 years, and she has spoken with many volunteers. And very often I hear from her, oh, this person called me, and I'm so grateful that she did. And oh, this other person called me, and it was a quick chat, but it was nice to hear from him, which always never fails to lift my mood.
So this quote is from a volunteer directly. He supports our participant ER. ER is an older adult that came to the program after the loss of his spouse in 2022. His mental health suffered. Oh, sorry. Can you guys hear me? Hello?
Yes, we can. It was just a wonderful hiccup that happens in the virtual world. It was stadium sound effects for you, Michelle. I know you love this story, so it's wonderful that you got that special effect for sure.
Yeah, it really drives it home. So this quote is from a volunteer who supports ER. ER is an older adult who came to the program in 2022 after the loss of his spouse, which is a common occurrence for many of our participants, because that's when they feel most alone, right? The person that they grew with is no longer there. His mental health suffered a lot to the point where he was no longer caring for himself or his home. With the help of this dedicated volunteer who shared the quote, he was able to connect to grief counseling as well as focus on his own health journey. So he quit smoking and he had dental surgery, which really helped him eat because he wasn't able to eat because of the pain of his teeth. And he had a lot of fears around that as well. So with the volunteer, he was able to have the confidence to face his fear and get that dental surgery so he could eat and thrive, which is so important. Now, the volunteer supports ER in his transition as a caregiver to to ER's brother in his own journey to fight cancer. The next slide, please. This quote is simple and it's from volunteer VB, and she writes, "Thank you for getting me through 2024. It's my turn to give back." VB has been in the program for 3 years. She's an older adult who lives alone and is homebound. She disclosed that she had not left the house in many years. After joining the Friendly Calls program she joined the Friendly Calls program because she felt lonely. After many meaningful conversations and connections, she's officially onboarded as a Friendly Calls volunteer and is giving back.
And I'd like to share this rather long quote, but I feel it's very important. So it says, "To someone who is a caretaker 24/7, this is a heavy responsibility. To be always the one on call day and night. I cared for my mother-in-law and her husband when they were in their 90s for several years. So many misunderstandings come up with friends and family members because no one really understands all that you are having to deal with. To talk with a neutral person, you can vent a little frustration and have a sympathizing and understanding ear." So this quote shared by participant BJM is very touching because when discussing palliative care, people can feel very isolated, and family and friends may not really understand the weight of what they're going through. And as such, they also, for their own various reasons, may not wish to tell them about what they're having to carry on. As such, the Friendly Calls does offer caregivers and basically anyone that essential connection, a safe space where they can feel supported, understood, and less alone in their journey. So for BJM, she has also shared that she enjoys sharing stories and prayers with her volunteers, and they love discussing what has happened in their lives over the previous weeks. She has been with us for 3 years, I think, 2 to 3 years, and she shares that she cannot wait to tell them about things that have just happened to her, and it has definitely helped bring a bright spot into her days. Next slide, please. So here, now that we've covered key highlights of the Friendly Calls program, social isolation, and all that, we like to open the floor for some conversations about how Friendly Calls can support people in the palliative environment, how the calls can support you. For example, we can also look at the questions here. But before we dive in, does anyone have any questions about what we've gone over in the presentation? Okay,
We
I
have
see
a question. We have
a
a
lot
few
of questions.
Let's start with Penelope. How do you get someone into the program, either as a volunteer or someone receiving calls? Doris, would you like to take that question?
Sure. So I'm just scrolling through all of the comments. A lot of lovely stories are going past, but how do we, yes, so if you want to join as a volunteer, you can simply go to our website and there's a process for you to join. It's very simple. I believe we have a link to that sign-on process towards the end. We can also share it with you if you'd like. If you'd like to refer someone or to join as a participant, you would also access it online as well. You can also call our national number. It's a 1833 number that I see Michelle has very helpfully popped into the chat. Thank you so much. So if you call that number, you can essentially speak with someone who will onboard you onto the program, and you will be ready to receive calls. I think that's just a very, very broad strokes description of how someone can join as a volunteer and participant. You obviously, as a volunteer, would have to go through training and courses to be able to make that first call. And yeah, is there anything I might have missed, Michelle and Asha?
If I may add, Doris, I think you did a great job explaining it, and just one thing to add would be you don't necessarily need to do it just for yourself. So there are times that a care provider may reach out as a third-party referral to they've received permission from the individual, or they've explained the Friendly Calls program. The person says, "Yeah, that sounds like something that I'm interested in, but I don't necessarily want to make the initial call. Can they call me?" So there's times that a care provider can reach out to that number too, or a family member to even just gather information first. And then the intake is conducted by a skilled staff person who really walks through to identify, is this a good fit? As Doris walked us through that impact, which is the acronym for the process, that initial intake is really conversational. For some people where it's not a good fit, we then try to guide them to a more appropriate resource. Where it is, then they'll be guided to two lovely human beings like Doris and Michelle. You have MBC and Yukon, which is fantastic. They're the coordinators for that region. So they would be the ones that would identify a great match with a volunteer and continue. So just to fill in the blanks, that it's not always needing to be the individual. It can be third-party referral. We do get referrals from care providers, as well as family members reaching out, asking for more information too. And as shared, we provide it for caregivers as well. So just wanted to add that element.
I just want to highlight one of the lovely comments in the chat box before we continue on to the questions. So Terry Weber, sorry if I mispronounced your name, wrote an amazing comment that I just want to highlight. It says, "I live in a fairly urban area, and I'm blessed to live in a complex where people have had the opportunity to reap good pension. I'm surprised that no matter their financial assets, people have loneliness and isolation, and it could be a real lived experience." And then she goes on to talk about how a small cup of tea or just sitting and chatting is a good way to improve the quality of life. So I think that's important, that it's to remember that no matter where you're from or who you are, loneliness and isolation can impact you. So thank you for that beautiful comment. The next question we have from Kaylee, it says, "Do you ever encounter people pushing boundaries of this and asking volunteers to meet in person to connect?" Asha, would you like to take on that question?
Sure. I mean, absolutely, that can happen. As human beings, sometimes we understand the edge of our boundary by pushing against it. At the moment, the program is primarily provided virtually, so traditionally over the phone. This is for the safety of both. And most times people understand and they respect that. If someone is seeking more of an in-person connection, then we can also work to identify, is there something formally structured within the community that they're living, and or to almost look at a social care plan, for want of a better word, and perhaps identify people they have in their own life, proximity to them, either proximity physically like a neighbor, or proximity emotionally like someone who they care about, and to walk through perhaps barriers for them to see them in person and how to navigate those. So definitely we train volunteers around boundaries of the service. They are established for the safety for everyone, but definitely appreciate there's times that people are going to, bump up against that. And we do try to work with them to identify perhaps an additional service or program that can be supportive of them. Often caring people come to programs like this, but they do appreciate and understand why currently we limit it to phone.
Great answer. And I think also the idea of having a phone service is amazing for individuals who might have mobility or immune compromise and that sort of thing. So the phone kind of also adds that extra layer of protection for their health as well. So we do have another question in the chat from William. He's asking for people receiving calls with the program, is there any sort of system for people when there is a climate change event or evacuation during wildfires? I just want to highlight this because this is a really important question. And obviously, living within BC, you deal with wildfires, you deal with extreme heat, sometimes flooding every year at least. So there's lots of variables in your climate and emergency. So within our Friendly Calls program in BC and Yukon, we are working to support our volunteers to become trained in Be Ready. And Be Ready is around emergency preparedness, and they support how to make a 3-day kit, which is a 3-day supply of everything you would need in an emergency, such as medication, maybe list of phone numbers, changes of clothes, evacuation plan in the event that you would have to leave your home for wildfire or flooding or that sort of thing. And they would go through that with our Friendly Calls participants. Along with that, we are prompting our volunteers to slowly have conversations around climate change and events like that. I do know a couple of years back, I believe it was in 2016, I think it was 65 adults, older adults, so 65 plus, died due to extreme heat. And this initiative of Be Ready that we are rolling into our Friendly Calls program is allowing our participants who are the most vulnerable within their communities to be prepared for those emergency situations. And our volunteers will hopefully prompt them knowing the areas that they live in and that are high risk. So I do hope that answers your question. I don't know if I left anything out, Doris or Asha.
I think that's very thorough. I'm also very excited to have our volunteers trained to support our participants with regards to climate disasters. Yeah, this is an important topic, so happy that you brought it up.
And it kind of ties in, yeah, it kind of ties in the basis of Red Cross because that's kind of emergency planning and emergency preparedness is where we got our start. And now we are connecting it with our Friendly Calls program to protect the most vulnerable. The next question we have in the chat is around NaviCare. So our NavCare program will meet a client in person to provide socialization and help. So I guess that was more of a comment. I'm sorry. Which that's a fantastic program that you have, Arlie. Maybe one day we could move to in person. I do know that prior to the pandemic, it was in person, and there was a lot of benefits to that. So maybe anything's possible.
Well, and absolutely. And a big thing for us is we don't want to duplicate service. We're here to amplify and make accessible the impact. So where there's, strong connections in person, that's fantastic. And our approach with it being virtual in a sense just allows us to fill in the spaces. Canada is a very large country, and with social isolation and loneliness, sometimes we can be physically isolated, even though technically we have physical access. So this is where, in some respects, a friendly calls can be an entry point. And then as people feel comfortable, that's definitely something, and I'm sure Doris and Michelle, you've heard this. I know I have on a national level, and I'm sure you have on the BC level, where people have shared, you know what, I find that I get out more, I reach out more, I feel more comfortable to engage. So sometimes it's not even so much that they're not aware of another fantastic service. It's just we have some people saying that talking to the volunteer might be one of 2 times they literally are speaking in the course of a week. So by strengthening that social muscle, feeling safer, they often feel more willing to engage and then look to those other services too. So for us, one of our mottos is to play well with others. So definitely we like to do cross referrals with other programs and services to engage and guide them to what's occurring in their community. And that's why we have those individualized referral pathways, where it's not just oh, you need this, here's a number. It's okay, what could be some barriers to you accessing that service, and really looking to see what would be a good fit for them, and then connecting them to great services like what Arlie was sharing around the NAV Care program, which is fantastic. And just something to add around the climate and community crisis situation, we do also have, prepare and care calls within friendly calls, so that people, as they sign up into the program, if they do want someone to connect with them, in preparation, before wildfire season or something, around those connection kits and the Be Ready program that Michelle was talking about, that's possible too, which is really great.
I just wanted to speak to that last point as well, that some of our folks are lovely human beings who are within the program are from very small communities, and especially with an Indigenous background, hearing people say, I want to connect to somebody outside of my group is very beneficial for them, because there's that I'm always gonna mess up how I say this. Anonymity, you know what I mean? Anonymous layer to it, because there is such stigma for somebody to join a program and it be supportive. Like, even though we are in 2025, there is still a mental health stigma. And so having a connection outside of your community is also beneficial.
I really love that point, Michelle, because we hear like in many different research spheres where people would travel long distances to meet like a healer because they worry in their own community or in their own village that, maybe rumors might spread or whatever because of the, compact small nature of their hometown, etc. So definitely the anonymity is an important piece.
I think that we need to get to our questions on our slide. So the first question, or sorry, the second question is, how do you see your Friendly Calls program supporting you or the people that you support? Feel free to unmute or share it in the chat box if you want.
We can just also like think back. Like I'm just thinking about what we talked about earlier. So many lovely stories shared by you all, and also from participant BJM. So for her, the friendly calls just allowed her to have that neutral support and that safe space for her to really talk about what she's been going through. Literally, she looks after her own family and then rushes over um, to look after her mother-in-law, and then she has to rush back in the afternoon to cook a meal, and then she has to go over there. So, yeah.
Yeah, definitely. And while we wait to see, I see Kaylee sharing about working in a hospice and seeing that this could be helpful for some patients or their loved ones. Certainly having that, recent and long time lived experience as a caregiver to someone who's palliative. As sure there can be an innate isolation because of the intensity of your workload and all the responsibilities. And as one of the quotes was sharing, that sense of it can be challenging sometimes to talk with someone and feel that they understand. So often with friendly calls, though our focus is 18 plus, anyone experiencing social isolation and loneliness, we do have some priority audiences, and this includes older adults, it includes parents and caregivers, also people living in rural or remote areas, as well as indigenous community members too. So there can be a very natural fit that can occur at times for caregivers. In the case where it's the individual themselves, there can be an added nuance to that. So we can look at that usually on an individual basis to see if it's the right fit for them. And if not, perhaps there's another service. So that's where, and I think it was mentioned as well, we have over 1,200 volunteers coast to coast to coast in Canada. And then we have a small team of, 18 trained, fantastic staff who provide that wraparound support. So wherever possible, if we're not the right fit, we try to work with people to find it as well. And I see Virginia mentioning about, helping people communicate with someone and feeling heard, how important that is. Yeah, and Angie also echoing your statement. Doris, definitely. Yeah.
Yeah, thank you for sharing. And oh, we have more. Terry says, my brain is thinking, would the program be willing to have a conversation after the webinar to do training for small groups whose mandate is to connect to provide compassion and understanding? Fascinating question. I think it would be great. Obviously, it seems like, more and more people need to have this social connection piece, and we're happy to assist in the ways we can. What do you think, Michelle and Asha?
For sure,
we
Terry.
both unmuted fast at the same time. I was going to say definitely. I think that's something that can be shared with the community health director in BCY to take a look at that, potential partnership and see what that could look like for sure. So I would definitely suggest, and Doris and Michelle get to work really closely with him. So I'm sure they can bring that forward to see if there can be some, potential sharing and cross training or sharing of information for sure.
Leanne has a comment here. I'm a community hospice social worker. I refer my clients to receive a friendly call for companionship and more informal support, especially if the client's family does not live close by and mobility is impacted. That's great to hear, Leanne. Yes, and as Asha mentioned earlier, healthcare professionals often will refer people that they work with to friendly calls. And this reminds me a lot of something where we call like social prescribing. I think doctors are also kind of leaning into nature prescribing these days. I know it's still on the forefront or on the edge of what we do have to offer to help people mentally and physically. And nature prescribing and social prescribing can still sound a little bit abstract, but sometimes people need that reminder to connect, to touch grass, I think, as a lot of young people like to say, and just to get out into the world and like connect with nature and other people. So definitely, we just sometimes need that reminder to connect with each other. And oh, Michelle, did you want to say something?
Oh, I was just gonna say, I think it's wild that something as small as talking to somebody on the phone can have such an impact, and it's so easy, right? Like you think of all the, oh, I need a medication to help with this, or I need you know, a a new diet, but like this is easy and pretty hands off. So it's like amazing, like going through the research and seeing what the impact is and how just calling, just talking, and it could be as simple as calling your grandma. Remember your grandma. Um, Sorry. Anyways, so let's move on to the final question really
Yeah, so
quick.
what are steps we can take to support each other? And thank you, Michelle, for mentioning, connecting with your grandma, because that's basically the first thing I think of when I think of first steps we can do to support each other. We can just reach out to that person who we've been thinking about, but haven't really spoken to in a while. I'm sure they would appreciate a check-in text or a phone call or even snail mail from you. And so, what are other steps you can think of that we can do to make sure we are feeling supported? Kaylee says, make necessary referrals. Thank you, Kaylee. Hard to disagree with that. Talking is always liberating, for sure. Virginia thinks that talking is a way to kind of share how we think and feel, liberate maybe what's on our backs, what's on our chests. Definitely. A lot of our participants mentioned that they can really open up and just talk about what's going on in their day because they think that maybe the people around them, if they have family members around them, they already know what's going on, right? But they just need someone to reflect that back and forth. And especially with people who are older, right? They just need someone to kind of volley information back and forth and really tap into being able to speak with other people, for sure.
I'm just going to jump in here because I'm mindful of time, and we try really hard to stick to the 1 hour for folks. So I'll let you do your final thoughts and wrap up, and then I have a little something to say as well. Thank you.
Well, that is great. I would really encourage you to reflect if there's an aha moment, perhaps a stat that surprised you, or an action that you're going to challenge yourself to take, either for your own personal wellness or for those that you care of. I encourage you to share it in the chat because it can be a really powerful way to inspire one another. And as far as reaching the program, I know there's been a link shared in the chat, which is fantastic. You can reach that toll-free number Monday to Friday, 9 a.m. to 5 p.m. and speak with someone, and they will connect you to the service. And just a very heartfelt gratitude for all of you for taking the time with us this afternoon, as well as with the palliative team for reaching out, and the BC coordinators for organizing this in tandem. It's been really positive for us, and hopefully there's been some takeaways for you as well, for your own personal well-being, but also that ripple effect, not just of social isolation and loneliness, but the ripple effect of connection and how powerful that is. So thank you very much, and over to you, Tina, for your wrap-up.
Well, thank you, Asha, Doris, and Michelle. Really great presentation. So wonderful to hear about this important program that Red Cross is offering and running and connecting people. I think some of us are aware of the health crisis of loneliness, and seeing how, as Michelle said, how amazing it is that really just a phone call can make such a significant impact on somebody's life, their physical and mental health. So thank you for sharing.